Check Podcasts.
Hi, I'm Bruce Williams. I'm the CEO of the Greater Victoria Chamber of Commerce, and this is Chamber Chats. I would like to acknowledge, as always, that I live and work in the ancestral unceded territory of the Lekwungen people. They are the Songhees and the Esquimalt, and it is a privilege and an honor to live and work alongside them every day. Chamber Chats is brought to you by the supports of Island Savings, a division of First West Credit Union, and as always, we are broadcasting today from the podcasting studios at Czech Television, one of our Chamber champions. 3 guests today. All of them are involved in things that are both innovative, creative, and in your best interest as far as your health is concerned, especially health in your workplace. We have had terrific concerns throughout the pandemic about the fact that the pandemic was spread by the means of airborne virus. Joining us to talk about a company called Origen is Susan Blanchet, who is the founder and CEO of Origen, actually one of our Business Award finalists. Susan, hi, how are you?
I'm excellent. Thank you for having me today, Bruce.
So this is this really cool company that you have, and a concept where you're kind of redefining what plants look like in the workplace. I was saying to you earlier that Amanda and I have a house full of plants, but they don't clean the air the way yours do. Tell me about the concept that you have with Origen.
So our secret sauce, like what makes us different, is our plants. Our plants were developed at the University of Washington for the last 15 years. And in 2019, I used my former skills as a lawyer to negotiate the license for our company. At first, we had a co-exclusive license. Now we have a global exclusive license to use these special super plants. And what makes them different is they have been genetically modified with an enzyme from your liver. So the same as your or my liver metabolizes toxins when we breathe, car exhaust or off-gassing from carpeting or furniture, our plants metabolize that the same as your liver does or mine does. And that's why we actually don't get sick or have a buildup of toxins. Our plants do the same thing to make you healthier indoors, which is where we spend 90% of our time.
Yeah, we sure do. So genetically modified in this case is not a bad thing. The enhancement of using these liver enzymes is but that parallels, like we always say that the trees and plants on the planet are the lungs of the earth. But you take this to another extent and make it much more effective, right?
Yes, I really see this next decade of where science, humans and art all kind of come together. Like alone, we can do our part, but together we can do it better. So I have a degree in environmental studies from the 90s when GMOs were a bad thing. But with our plants, the worst thing that's going to happen is you're going to have cleaner air. And it's a pothos ivy. So it's been modified as well to not flower. So if it did escape outside, it wouldn't reproduce. It would not be able to flower and it would die because of our cold temperatures. So it's the perfect plant that we chose to modify. And we just use it inside of our air purifiers, which are combined with traditional HEPA filtration, IoT sensors to provide a self-sustaining hydroponic chamber. You just plug it in and enjoy the oasis.
So as I mentioned before, of course, the COVID, it was spread by airborne principles. We all became very fearful of that. We started wearing masks. We worried about being in enclosed spaces. So, retail stores, offices, other workplaces, this is where your product comes in to complete effect, right?
Yes. And we've pivoted a little bit because of the pandemic. First, we didn't know what if HEPA filters would clean it. And HEPA filters are or can be 99% effective on removing bacteria and viruses. Our plants will then remove the volatile organic compounds, which are things that cause dementia, asthma, cognitive decline, cancer over time. So we're really going for the multi-barrier approach. And we've also filed a patent on a UVC chamber, which will then be the last stage that could denature coronaviruses or other viruses in the future to keep us safe indoors. And one unit cleans about 8,000 cubic feet. But we've gone a step further than that. And our goal in the future, this is our plan to roll out this year. But you have to have what you call a big, hairy, audacious goal when you're an entrepreneur. And what has happened indoors is all of our air exchange systems have been doubled. So what that means is our greenhouse gas emissions have been doubled, and they were already too high. So Origin Air is developing for the future an HVAC integrated air system that will reduce GHG emissions back to the normal levels and 40% more pre-COVID levels, which for us, we're a sustainability-based company, and this will help us reach some of our Paris Accord goals in the built environment.
Okay. And as much as this is all about the science, this is actually a very attractive, almost artistic looking installation. Tell me about that.
Yeah, so we definitely like being at the juncture of art, science, and nature. So we've brought art into our design, and it's a very beautiful. Like a lot of times when people see it, they're just like, "Why are the plants behind glass?" Because we've hidden all of the mechanical functions of our unit, but it truly is a very scientific machine, even though it looks like a beautiful piece of art or office furniture even.
So that would mean, I guess, that when we have these in our workspace, we don't have to water them or anything, do we?
No, so it plugs in because, my partner was a former living wall company supplier, and so he found all the fail points that came with living walls. First of all, you had to plumb it in, you had to come back often to fill up the water. People might turn the water off and they wouldn't call you until the plants were dying or dead.
Yeah.
So what we've done is fixed for all of those problems. We have sensors that tell us when the water's low, when the door it gets opened. If the unit is unplugged, we will know and we will come and fix it.
So there's that well-being and that feeling of peace that when you're in a workplace or a living space or anything else, because of what you do at Origin Air, we can breathe easier, knowing that the breathing is quality air, right?
That's our tagline. We breathe life back into your workspace. But not only the air quality, also, as you say, the biophilic design. Like the plants that you have in your home also have this, they might not clean the air as well as our genetically modified ones, but they do have biophilic, which is what we use to explain how people feel when they're surrounded by nature. And it makes us feel good. It makes us feel more productive and be more productive. So that's a big part of what we do too, just bringing, not just breathing, but bringing life back inside.
Susan Blanchet is the founder and CEO of Origin Air, and we're going to be having Susan back in a future program to talk about more of the innovation in workspaces that's going on. But Susan, thank you for being with us. Next thing we're going to talk about is having a medical practitioner come to you instead of you going to them. On Chamber Chats today, we're speaking with some people who are doing very innovative things in the healthcare space and in the workplace sector as well. My next guest is the founder of Air Mobile Medicine. She is a doctor of Chinese medicine. Her name is Mercy Southam, also one of our Business Award finalists. Mercy, you are coming to us from your facility. Tell me where you are right now.
I am indeed. I am actually in my mobile clinic right now. I'm parked in a neighborhood in Oak Bay, and I'm just about to head to a farmer's market. So the beauty of having a medical clinic on wheels is I can go just about anywhere my patients are.
There you go. So, previous generations knew about house calls. Doctors would make house calls. They'd get in their car, they'd bring a little black bag, come in the house, see what's going on. So you're a variation on that, but you're a practitioner of Chinese medicine. So before we move any further, the traditional publicly funded healthcare system has been at challenge for quite some time because trying to keep up, especially with the pandemic. So people who are practitioners like you must have seen an increase in demand, have you?
Most definitely. Yeah. The last 2 years have been, obviously transformational for everyone. For allied healthcare professionals, so acupuncturists, naturopaths, massage therapists, chiropractors, we have seen a massive increase in demand for our services because people now see the importance in staying well as opposed to avoiding getting sick or just healing an acute illness. Chinese medicine is a body of medicine that actually treats the whole person holistically, and it's a really powerful preventative medicine. So, the best way you can use Chinese medicine is actually before you even get sick. That's not to say that it's not incredible when you do come down with the common cold or you're dealing with digestive issues or stress. But if you can bring your body into a state of balance through acupuncture, herbal medicine, and lifestyle shifts, that's when we can really see the optimization of our health.
So instead of waiting until you get sick to see somebody before you get sick.
Exactly. And you'll see that it actually increases the quality of your life. So we really are used to, in our society, moving through the world with pain, with discomfort, probably not operating at our peak capacity. And we just think of that as normal. And during COVID and during the global shutdown, people really started to think about what was most important to them. And really at the core of it all was our health and the health of our loved ones, right? So if we can create a medical system that prioritizes staying well instead of just responding to disease, that's when we can really create an impact in our communities. And that's what I'm most excited about as a practitioner as well.
And just as full disclosure, I use holistic medicine in my life, including acupuncture, and I can attest to the fact that it does make a pretty big difference. Okay, so you're sitting right now, you sit in Oak Bay somewhere. You travel across the region. So if somebody wants you to come to their home or their workplace, do we have to provide something? Do you need to plug into something? Do we need to give you access to water or anything like that?
No, that's the beauty of this space. So when I created this mobile clinic, I knew that I wanted to be completely self-sustainable. So you can't see them, but there's solar panels on the roof. I'm completely able to provide my own power. I have water tanks underneath that countertop there. So I don't need to plug in. I can just literally roll up to your door. I've had patients who have preferred to get treatment beachside, which is always kind of
Hmm.
nice. I've gone to people's workplaces and being able to treat an entire office throughout the day. So it's a really versatile way of providing medicine. And for those patients who aren't able to access this mobile clinic space, or perhaps they don't have appropriate parking at their location, whatever it may be, I'm also able to do the old fashioned house call. So I do have a travel kit that I can take into people's home as well. But the patient does not need to provide anything but a little bit of space.
Yeah, we can kind of see behind you the size of the unit. So yours isn't one of those motorhomes that's like half a city block long. It's more a kind of a medium-sized unit, so it can fit into a lot of spaces.
Yes, I am the doctor of Chinese medicine, but I am also the official driver of the mobile clinic. So it was very important for me to have something that could maneuver the smaller streets of Victoria. So I am actually in a 1993 Winnebago RV. It's 21 feet long. And somehow I haven't had a problem with driving it around the city. So it's definitely catches your eye when you see it on the street, but it's not too big. I can usually park pretty comfortably in any regular size parking lot.
Yeah. So who did all of that, the refitting on the inside? How was that done?
I wish I could say it was me, but I did not. I did do the design of this space. I wanted to make sure that I created a healing space that people could really get just removed from their ordinary day to day experience. I wanted people to step in and really just have that environmental transformation. The physical work was quite robust. We worked on it, myself and a gentleman actually on the mainland who specializes, get this, in renovating motorhomes into medical clinics. Very
Wow.
niche market. I know. It's amazing what you can find on Google. But he actually has worked a lot with the government of Alberta doing their mobile health units, everything from general practice to dialysis units. So I contacted him and we partnered up for about 11 months. We worked on this. And we ripped the roof off, we tore the back wall out. It was quite the operation. Yeah.
How many people can you treat at one time, and how many can you do in the course of a day?
Yeah, so at one time, I can treat up to 2 to 4 patients. Comfortably, I would say best to do two. You can see my 2 treatment chairs in the back here. Acupuncture is such a wonderful medicine because it's so mobile. So I treat all my patients seated. I know if some people who go to acupuncture are able to lay on a traditional massage table, that's not always necessary, not always the case. So I do a lot of couple treatments, a lot of friend treatments, mother daughter treatments, and everything in between. And in a day, it really does depend on if I'm doing a workplace or if I'm focusing on an event or if I'm doing house calls. Comfortably, in a day, I can do anywhere between 7 to 15 patients a day. Today, I'm going to be at the farmer's market, so that will probably be about 6 to 10 patients.
It's very cool. That's why you were a business award finalist with the chamber. Um, Mercy Southam is the founder of Air Mobile Medicine. The website, if you want to find out more, is Air, EIR, mobilemedicine.com. And Mercy, we're going to have you back on a later program to talk more about what you do, but thanks for your time today.
Thanks for having me.
Okay, next up, we're going to talk about something that is rampant, pandemic or not, and that's our mental health. On Chamber Chats today, we're talking about how people are managing their overall health in their workplace, the return to workplace, the effects of workplace on their life from day to day. To talk about that next is Sally Ann Haug. She is a therapist and she is the owner of something called Mental Blocks. Is that the best way to describe your operation, Sally Ann?
Mm-hmm.
Okay, so
Yeah. Mental blocks, EMDR therapy.
so you're another person who, in the course of the pandemic and even previous to that, people found that the traditional public healthcare system couldn't always keep up with demand. And as we have seen, as we've said many times before, the mental health impact of the pandemic will be greater than the economic impact ongoing. How much of an increase have you seen, especially in the last 2.5 years?
Oh, I can't even give you a number. It's overwhelming. I would say overwhelming. It's really taxed the system. It's my colleagues have been taxed. It's really affected their own mental health, and it's really hard to get in to see somebody even privately because people have wait lists. So I don't know what the numbers are. I myself won't take a wait list because I want people to get service. If they're coming in, that's a hard enough thing to do. So I really want people to get service as soon as they can.
So we talk about mental health, we talk about stress, but we have to sort of break that down and unpack that a little bit. So it's anxiety, it's uncertainty, all of those things. What have you been hearing from people most recently? What are the elements that they're having the most difficulty managing?
I guess they're feeling really pushed. And I think it's not just the employee that's pushed, it's the supervisor, it's the team lead, it's the management. And it's also the uncertainty. Am I going to be able to keep my job? How do we adapt to demands? All of the instability. And it's not just if they're in a family, it's what about their partners, their kids interacting socially. They had all these protocols in place, and now we're going back to work. It's this push and the pull. It's that we are wired to connect, but we're also wired to keep ourselves safe. So how do we maneuver that challenge? Because as human beings, we need to connect to people to be healthy. And it's so vital.
Yeah, and even some people that are now concerned about doing this back to FaceTime, back to in-person because of the uncertainty that's just compounded over this entire thing. How are you best telling people to manage that or best cope, if you will, with that?
Well, I think it's really important to stay up with protocols. I think it's important to respect people's differences and their opinions about how these things should be approached, to listen, to validate, to acknowledge. Everybody's doing their best, and I think we need to keep that in mind. And assuring employees, okay, this is what we're doing in order to ensure your safety. And I think it's very important that employees are heard, and also management and team leads. And I think everybody needs to be validated and acknowledged where they're at and how they can be best supported in this.
Yeah, I want to talk in a second about a couple of your specific practices and methods that you use. How much do you think has the idea of virtual work become like that disconnect from face to face that people are doing as we're doing right now on Zoom? How much has that been a factor in people's isolation, frustration?
I have to say that I was actually in the States when it all first started. So when I phoned to the island and said, okay, how am I going to do my work? It was all on the phone. And I was very panicked because so much of our communication is through our body. And I'm thinking, okay, how can I manage risk? How can I, assess risk if I can't see somebody? So I was seeing people on the phone, and I found it to be pretty effective. But some people aren't they aren't familiar with technology. I was working with a lot of people that were retired, and they wanted to continue to see their doctor in person. And that 5 minute on the phone, it just wasn't enough to say what they needed to say. And people were getting frustrated. People were lonely. There were so many things happening. And so some people really adapted well to the virtual. I'm back online a lot. So I give people the option. I have an office, so people come and see me in the office. I can go for a walk with somebody, which is great because they're out in nature, which I think is important for health as well. Or they can meet me online. So it also takes a lot of stressors away, because people that were having problems with social anxiety before the pandemic really were thriving because they didn't feel as much pressure to be going out and mingling with people. So everybody's different.
Yeah, there are still going to be a number of people who cannot overcome the stigma of asking for help with their mental health. They struggle with that. So maybe this sort of Zoom thing provides a little more element of privacy for people. But I want to talk in particular about at least one of the things you do, which is something called EMDR. Tell me about that.
EMDR is a therapy approach that's quite different from it integrates other kinds of therapy into it. But what it does is it considers how the past is affecting your present. So it's thinking about, so say you're in the workplace and you have fears of approaching your boss, so say for a raise or negotiating a schedule, and that may come from a past experience, and you may have a belief about yourself like, I'm not worthy of that raise. So it gets in the way. You can rehearse it, you can practice it, and then when you get into that, you have these fears, because when we're upset, this is why it's so important to take care of our mental health. When we're overwhelmed, our brain doesn't process information very well because we're wired to keep ourselves safe, like I was saying earlier. So we don't process information as well as we would when we're calm. So that's why it's so important to manage stress and to manage anxiety and to take care of yourself, to be around people that, love you unconditionally and accept you. And you're taking care of yourself, you're exercising, you're sleeping, like the holistic, the holistic approach, like you were saying. It's so vital to how well are you sleeping? How are you eating? Are you eating regularly? Are you eating enough? And that's the first thing I do when I meet somebody. I really look at the big picture. How are you coping? What's your motivation like? What's your energy like? What's really happening? And figuring out how these things are coming into play with their mental health, because it's all tied together. So it's all vital.
Yeah, we're going to have you back on a future chamber chat as well to talk more about this mental health, the whole management of it all. But I can't stress enough something that we've said a number of different times, that it's not a sign of weakness to ask for help in managing your mental health. In fact, in my mind, it's a sign of strength to do that, to recognize that it's the right thing to do for yourself and for everybody around you. And that's a
Absolutely.
fact, right? Yeah.
Yeah. Yeah. And it's really great to get help. And when I work with people and I do EMDR therapy, it's so freeing to change the beliefs that you have about yourself and to change that narrative, from I don't matter to I matter. It's so important. Just, it seems so small, but it's huge when you walk into your life and that's acting as your compass.
Sally Ann Haug, the best website for us to find out more about you, would that be mentalblocks.net? Is that a good place to start?
Correct. Yeah.
Okay.
Mentalblocks.net.
Right.
Yeah. Thank you.
Thank you. Sally Ann Haug will be back on a future chamber chat as we talk more about managing our collective mental health. Mercy Southam joined us from IR Medical Medicine, the mobile medicine operation in her motorhome. Thank you to her, and to Susan Blanchet, the founder and CEO of Origen. Thank you all for being with us today. I'm Bruce Williams. We'll see you again for another chamber chat.